like to introduce John McDermott. John is also an ILRI alumni. He was the Deputy Director General for Research at ILRI for a number of years, based in Nairobi. And in 2011, he moved to IFPRI, the International Food Policy Research Institute, based in Washington, where he's now the director of the CGIAR research program on agriculture for nutrition and health. And John has a background in quantitative epidemiology, veterinary medicine, and he is qualified as a vet. And he's done a lot of work in the area of public health, animal health, and the whole broad intersection of those disciplines with livestock research in developing countries. So John, most welcome.
Thank you, Shirley. I might be qualified as a vet, but don't bring your animals to me. I don't think it would work very well. Now, this morning we had some interesting overview presentations. And our job in this panel is to really dig down below some of those headline statements we heard this morning into something bigger and looking at the relationship between livestock and human health. And as we heard this morning, it's a kind of complex story. And it has quite a few contradictions and kind of counterintuitive things about it. And the role of livestock is pretty controversial. So I want to develop a couple of storylines and then work them through with the panel. So one is on the relationship between livestock and nutrition. And we heard this morning about the importance of milk and meat and eggs, the kind of super nutritious foods that everybody needs to eat some of. And from my point of view in looking at nutrition outcomes, it's really hard to imagine how we're going to nourish infants and small children if they don't consume a bit of meat or drink some milk. It's hard to imagine how we're going to accomplish this. So that's the kind of good news according to livestock. Now, it's also fair to say, I think there's a problem of consumption here. So even though we know it's a good thing for poor people to eat meat or drink milk, I guess you can homogenize them so they can do both. We haven't done a good job compared to cereals in terms of the supply and the price. Okay, so the relative prices of cereals since 1970s are 60% of what they were, and the relative prices of meat, milk, and eggs are 130% of what they were. So it's tougher for poor people to afford these things. So that's the one side. I think the really bad news about livestock is that people with more money actually overconsume. And so a lot of people suffer from obesity and the related non-communicable diseases, and this is no longer just a problem of rich countries. It's a huge problem in middle-income countries, and it's coming to low-income countries as well. And so we get a very rapid transition between kind of undernourishment on the one hand and overnourishment on the other hand, and it happens quite quickly. And it's something that we'll be exploring a little bit, how to bridge that transition. So that's the kind of livestock nutrition story. What about livestock health? Well, you hear a lot about the role of income and the kind of income story, and it's clear that richer people are healthier than poor people. We know that in general. In the development sphere, though, that's probably not good enough, and we need to take more proactive actions. It's really important to think about, for example, how people get to be poor. And it's generally around health crises, and it's generally around multiple health crises. It's not just a single event that usually pushes people into poverty. It's multiple. Somebody breaks their leg, somebody else falls sick. A lot of things come together. And the important role of livestock assets in kind of buffering and providing the health insurance that doesn't often exist is quite critical, and we heard about that. I think that's an important role. But the bad news about livestock is there's considerable health risks associated with livestock. Food safety. The most nutritious foods are also the most risky. You're not going to get very sick eating rice as compared to eating spoiled milk or meat. And if you look at intensification of livestock, we're all talking about increasing the supply of livestock. With a lot of intensive livestock, we get quite severe problems with environmental contamination, the microbial populations. And then you heard this morning about emerging diseases, that 3/4 of the emerging diseases are coming from animals in people, and that they emerge every 3 to 4 months. So there's some big risks associated with livestock that we're going to get our panel to look at. So those are kind of the livestock health facts, if you wish. But there's a lot of controversy about this, and how do we need to develop this story within the panel and then push it forward tomorrow? Well, I think one of the things is that depending on who you ask, you get a very different story about livestock. So you get some people, and most of you in this room, who will emphasize the good news according to livestock and how it's important for incomes and assets and healthier lives and nourishing young children. And that's all important, okay? Then you'll have other people that emphasize the bad news, the overconsumption, the environmental concerns that Henning talked about this morning, the infectious disease risks, the non-communicable disease risks. And so somehow we need to balance this and be much more responsible. And there's a lot of efforts on that. So there's two parts of this story. One is, and I think Henning said something very, very good this morning. He said, generalization doesn't help. And it's very important for us to look at the different settings of livestock and how that works. I can remember debating this point with somebody from Friends of the Earth a few years ago. And at the end of the day, we agreed to disagree because she said, yeah, I'm not worried about your smallholders in Africa and what they're going to do. That's all fine. Leave them alone. I'm worried about overconsumption and factory farming in the United States. And so, you know, we just talk about different subjects, basically. But so how do we drill down on the kind of specific issues? And then the other thing is, how do we deal with the complexity? And that came up a bit in questions this morning. What we want to, we've got this kind of economic development agenda where livestock is very important, high value added. You heard ministers and other people talking about that. How do we fit that, can make it converge with the kind of health issues? So how do we link wealth with health? And they don't always fit. So how do we make that fit better? So I think those are some of the key storylines, panelists and others, for moving forward. Now let's drill down a little bit into how to make those work with our panel. And we've got three distinguished panelists. I first want to introduce Walter Maseca. And Walter, I think, is well known to many livestock people. He's, at the moment, the sub-regional representative for Eastern Africa for OIE. I think those of us who are a bit older remember Walter in his days as the director of AUI Bar and as a significant researcher in animal health and CBPP. So Walter has a wealth of experience. Then we have Julia Rowella-Mira. Did I get that right? Yeah. It's spelled wrong in your program, by the way. And she's the managing director of Sasakawa Africa Association. And Juliana has some very good insights and some very practical insights for us this afternoon. And then we have Vish Nene, the director of the Livestock Vaccines Initiative at ILRI, and we might be able to drag him even into human vaccines a little bit, perhaps. And he'll be looking more at the technology angle. So let me join you, panel. Walter, I want to start with you, so can you grab a microphone? When Lauren was talking this morning, he talked about healthy livestock, healthy people. Sounds a lot like One Health to me. How do you see One Health? How is it important?
John, if you allow me, can I start with the commercial?
A short one.
So, sorry, I apologize. I was saying, I was starting with the commercial, and I was saying that I look at the 40 years of existence of ILRI with nostalgia. Because it happens, I was in that team in 1994 that recommended an amalgamation of ILRI and ILCA. So you can see, I must see these 40 years. Have been very important for me. But now talking about the One Health question. We at the OIE, at the FAO, and at WHO tripartite agreement to deal with One Health. That shows you how important it is. But when you're talking about One Health, really, you're talking about zoonosis. But I'll just give you one example of one zoonotic disease that you appreciate. Take rabies. You know, rabies, good people, if you control it at the dog level, you have control it in human beings. Because it's much cheaper to work at the dog than to treat an affected person. That's what it is. And the other thing, which is really relevant to One Health, the emerging diseases. We know for a fact that 6 to 7% of emerging diseases for man are unknown. And therefore, we really have established systems, diagnostic surveillance, and other systems to detect the emerging diseases. You know the story of that. It's very simple. I think that's what I'm saying.
Okay. No, that's a good start. Now, over to you, Vish, because kind of Walter has raised the issues about One Health, emerging diseases between livestock and health. I want you to look at two issues. So one is kind of, what are some of the technical options for the control of these diseases wherever is most appropriate? And it could be humans or it could be animals. And then the other one is the One Health approach. Another angle on it is the whole environment. And so can you say something about the kind of technical options for bringing together all these different things?
Sure, thanks, John. Before I go down that road, maybe I could just make a slight clarification. To me, One Health just doesn't mean zoonosis. It's more than zoonosis. And so I think that's quite important. And so we have endemic diseases, we have epidemic diseases, we have emerging, re-emerging, vector-borne diseases, all of these things to contend under One Health. And to me, zoonosis is a subcomponent of that, which is gaining importance for obvious reasons that have been touched on in this forum so far. So in terms of the technological solutions, I think Lauren made a very good introduction to them. And for me, I've been described as a gene jockey. So it all boils down to genes. Genes either in terms of the host, genes in terms of the pathogen and their interaction together, and then also with the environment. And as Lauren was explaining, we're really down a road now where there's a huge transformation that's occurring in our level of understanding and being able to dissect those and then exploit them in terms of coming up with solutions from biotechnology. So that's really what I see. That's the exciting thing that we're going to be able to tap on in the next 40 years. And when we have this next meeting in 2054, I hope my genes allow me to be here. But if they don't, I'm sure there'll be a little help from biotechnology that will allow me to participate.
So we have this kind of promise of biotechnology, but how are we going to apply it in some of the specific situations that are of interest? I mean, there will be some hot spots, there will be some cold spots. How are we going to be smart about using our biotechnology tools?
Sure. So it's not just a question of the biotechnology tools, it's also a question of using information more smartly. So we just as there are transformations going on in biotechnology, there's transformations going on in ICT, information technology, the ability to be able to integrate large data sets. And one thing that I think the road that we're going down here is in automation. Automation in a large number of different areas that would allow actually intelligent design in our ability to be able to detect and predict and perhaps then also control these diseases.
Now, Walter, you represent a number of member states in Africa around control of infectious diseases. What are their key issues in terms of exploiting some of these technologies and surveillance systems and information systems that you're really trying to push at the kind of global level? Hold your microphone close.
Close to me. Oh, good. John, I work with the OIE, and OIE has a membership of 180 countries. 50 of them are African countries. And the number one thing which must be done with regard to disease control is strengthening the veterinary services. They must be strong and responsive. One, we have a system of PBS. PBS has 3 areas. One is accurate diagnosis of what obtains in individual veterinary services. And two, identifying the gaps which you find in veterinary services. And three, establishing how to deal with those gaps. And this must be done and be done very well. We are lucky in Africa that the majority, only two countries in Africa, the new ones, South Sudan and Liberia, have not had their previous analysis done, but the rest of them have done. Countries in Asia have done it. Emerging countries from Europe have done it. And I can assure you that is one area which must be strengthened. And that in that previous we also include education, because we want a global situation where the one veterinarian is as competent in America as he is in Africa. Thank you.
No, thank you. And this whole point about organization and institutional reform for surveillance and then how it can exploit different tools is really important. Now, Juliana, I want to move to you, okay? And if we think about livestock development, if we think about agricultural development in general, one of the big development tools that we have is value chains, okay? What are some of the practical efforts you make in developing value chains in Sasakawa target countries that are really going to help nutritional quality and food safety moving forward?
Let me start by saying happy birthday to ILRI and congratulations for hard work. Value chain is a paradigm shift, because in the past, I think agriculture, whether it was crops or livestock, meant production. Produce, produce, produce. It is no longer adequate to just encourage farmers to produce. But we have to go the value chain way, and I think everybody in this room is already converted. What we have to do is to convert the farmers as well. That is, after production, then what? And sometimes farmers have bumper milk production or crop production. Then what? We have to capacitate them to be able to handle post-production issues, to be able to process, to be able to move to the market. They cannot be able to move to the market in the raw form. We have situations where food distribution or food transportation, especially animal food and any other perishable food, is difficult for the farmer to move to the market. By the time they get to the market with their milk, it is spoiled. They can't sell it. They have to go back with it. By the time they get to the market with, if they have slaughtered the chickens, before taking to the market, the meat has started to get some smell. So the food, animal source food distribution is an issue, and is part of the post-production issues that we have to deal with. Processing, for example, processing of milk. We have a group, this is a practical example, we have a group, for example, in a place called Asinegele here in Ethiopia, of women processing milk to get different things, cheese, pasteurizing the milk, and so on. Guess what? Sometimes there is no electricity, and they cannot continue with their activities. Okay, after processing, going to the market is still an issue. The farmers have to learn the negotiating issues at the marketplace. Setting prices is still a problem for them. I'm an economist. I ask them, how did you decide that a liter of milk is 75 birr? They said, well, I went to the supermarket and checked the labels on what they are selling. They have to learn the skill of selling. Then we have issues related to transportation, which I've mentioned before. Going to the market means carrying whatever you have to the marketplace, or attracting the consumer to your place of manufacturing or processing. And we have a number of farmers especially women, who try to attract consumers to where they are working. That makes it very easy for them. But at the same time, they have to deal with other value chain actors who are important. They have to be linked to other actors. For example, they need to improve or increase their activity. They have no capital. They have to be linked to microfinance. They don't know how to do that. And you cannot go one by one and expect to get anything. They have to be organized. In the morning, and I think even this afternoon, we heard about farmer-based organizations, especially cooperatives here in Ethiopia. In other countries, is other types of farmer-based organizations which are strong enough to negotiate for themselves, to have a voice, to talk for themselves. That's what we need the farmers to do.
Now you've made this, and it came up in the kind of last panel, this plea for kind of business development and all the different associated things that it takes. But we know that that often isn't enough, and that households get left behind, children are still hungry and malnourished in countries with strong economic growth. What are the kind of additional things that you do in the field to help those households, to help women, to deal with some of the equity issues? You know, we heard from the minister today about their agricultural growth program, but they also have a poverty support program here because those two need to come together to tackle these issues.
It should be a lie if any of us here would say asset ownership in any community, especially in Africa, sub-Saharan Africa, is equal between men and women. It is not. Okay? Women have less assets, and what they have is different from what the men have. If we look from the area of the industry of livestock, most men have the big stocks. The females have the small stock. That's what they can handle. And the decision as to how to dispose of those assets, some women have full decision, others have to consult, and so on. So if we are going to use livestock as an asset that can help to improve food security, healthy living, economic well-being, we have to empower the woman, because the woman takes care of not only herself, but her children, her neighbor, her cousins, and so on and so forth. We are still playing lip service. We are still playing lip service. And when it comes to actual action, the programs could improve. For example, we have programs in SAA where we say women-assisted program. Then you go to a country, you find that the group didn't find women to join the program. You say, okay, in that case, we take this budget from this country to another country where we can find women. They say, oh, okay, we will find the women. Okay? There are a lot of barriers out there. There are a lot of barriers. We go to a place where they say women can still, today as we speak, not easily get out of their households to go out there and fend for themselves and their children. These are the facts of life we have today. Then we have issues of land tenure. These vary from country to country, but we have had issues, for example, in Nigeria among Fulanis and other tribes, where there are a lot of wars fighting over land between livestock owners and crop producers. And because the tenure system is not clear, so each one feels they have the right to do what they are doing.
Okay, thanks, Juliana. I mean, I want to bring us back to some of the health issues here. And so when we talked about kind of differential responses to health and how you might do something different in some countries versus others, I think the one that strikes me that's quite important is food safety. And food safety is a huge and growing issue. I think everybody sees its importance. The issues probably for African countries and members of OIE are going to be quite different than some of the rich countries. So how do you handle that? How do you look at those negotiations, Walter?
John, at the OIE, food safety is our responsibility as far as the live animal is concerned, but once it gets to the butcher, it is now the responsibility of Codex. And that division is very clear. But what's relevant for us is drug resistance in food safety, antibiotic drug resistance. The medic holds very clearly that the vets with their needles going behind cows and others that cause this tremendous drug resistance. Of course, we could argue the other way with medical assistance and others, but that's not the issue here. So for us, drug resistance is a big subject, and I would want to suggest that perhaps from a research point of view, it would be interesting.
Okay. So there's one point. The kind of food safety issues are very, if you look at low-income countries, for example, there's a lot of informal or wet markets, very different, millions of smallholders, very different issues. And obviously institutional issues, it's not so much a privately run food safety system with some public sector oversight. It's a very different kinds of systems that we're dealing with. And there's also different technical challenges, Vish. What do you see as the kind of opportunities for technical solutions to help in these informal markets where often farmers face poor people face barriers to entry?
That's a good question. So some of the solutions could be biological in the sense of from vaccine perspectives. So you could have vaccines in terms of reducing the threat of organisms that create food safety issues. The others could be simply technological solutions in terms of treatment of livestock products and handling them in a smarter way so that they're actually preserved longer, they maintain their safety status, etc. And then as we see a reduction in diagnostics also taking place, the ability to be able to perhaps have some kind of screening systems in place before they get consumed, that would be the third area that I would see would help to mitigate some of these problems.
So if you could have one thing on the technical side, say in the next 10 years, that would really be a game changer in the whole area of food safety, what would it be?
So let me retreat into the area that I know the most about, which is infectious diseases and the food safety issues associated with them. I think it's the ability to be able to essentially negate those threats due to the appropriate use of either biological control or vaccination strategies.
Okay. Now, Walter, I want to come back to you on the food safety because, there's a huge issue in poor countries and with lots of kind of informal market agents of what are the standards and how might those standards change. One of the, I think the big changes in OIE in the last 10 years is, kind of thinking about risk-based approaches and equivalence. How do you see that translating into more effective actions in African member states in the next few years?
John, informal markets in Africa are very complicated. He talked about the Fulanis. I can talk about the Maasais in Kenya. These guys have access to drugs. It's nothing that really you can do. And the only suggestion I would make really is for the governments to have strong control systems, particularly perhaps the development boards and others that could control this careless use of antibiotics all over. But it's a problem.
There's the kind of regulatory side.
Yeah,
and I
must be,
want to
yes.
pass over to Juliana because she was talking a lot about organizations, organizing people in value chains. Obviously, those value chain people have to take responsibility for the safety and quality of their products. How do you see that developing in some of the institutions you support?
Yeah, I think we have to make institutions take responsibility for their actions. If, for example, a livestock medicine seller sells something that does not work, we have to be able to put him to task and say, after the farmer tries to use it and it doesn't work, we have to take him to task. They have to take responsibility. And these days, by the way, farmers know what is right. You can no longer cheat them like they were cheated before. They are very shrewd. They are poor, but they know what they should get. What we have tried to do in Sasakawa Africa Association is to create what we call commodity association traders who are within the communities. The people know them, so they will make them answerable, meaning these are like middlemen, if you like, but who cannot cheat them because they know so-and-so is so-and-so's son, so-and-so is so-and-so's daughter. They are within the community. In terms of selling inputs to the farmers, whether it is medicine or whatever it is, or taking produce from the farmers, helping the farmers to bulk, if it is milk, bulking the milk, processing it together, and leading them to a bigger market. It is easy for the farmers to tackle someone they know than someone who flies in and flies out. I think this is working in the areas where we are working, to have these smaller dealers than to have these huge conglomerates who the farmers don't know, and they don't know where to follow them up.
So we've had a kind of very interesting discussion about some specifics of livestock in terms of how value chains are organized, regulatory aspects, technical innovations, and things like that. We're looking to give some advice to ILRI on what their future agenda is. If you could ask for one thing from ILRI in the next 10 years, what would you like to see 10 years from now that they would really deliver?
One health the emerging disease problems.
So understanding that better. Juliana, what would you ask?
I would ask to see more prosperous smallholder farmers working with ILRI.
Directly with ILRI or with other people?
Of course.
You think ILRI should be out there taking the job from Sasakawa of working directly with smallholders?
Well, let me end at prosperous commercial smallholder farmers, whether they are with ILRI or any other partner of ILRI or any service provider.
Okay, what are you going to work on in the next 10 years that's going to make a difference?
So what I would like to see is actually what we're doing is great. So it's a pitch for that, right? Well, which Jimmy talked about it anyway earlier. So what we're doing is undertaking and looking at how do we accelerate developing technological solutions for the biological problems that afflict smallholder farmers.
In real time.
In real time.
With the decisions people have to make in real time.
So are you going to ask us what we're in 50 years' time?
Okay. So in the interest of time, I think you've heard the views of our three panelists and the kind of overall story. And I think we'll be coming back tomorrow with some of these issues, and then they'll be developed further in the kind of round tables. But I'd like you to join me in thanking our panelists for their contribution.